Dasman Diabetes Institute concluded the second International Gulf Clinical Skills and Simulation Conference with the theme Innovation and Evidence in Clinical Skills Education for Safe Education. The two-day conference was organized in collaboration with the University of Dundee and featured participation of doctors, academics and researchers from all over the world, tantamount that the conference is gaining momentum and popularity. Sarah Farah's Globe was there and has this report.
The second International Gulf Clinical Skills and Simulation Conference continued its activities on the second and final day, where lectures and workshops were presented about the dynamic and exciting field of simulation-based education.
The first Clinical Gulf Conference we did last year, the participation wasn't as big as the one we have this year. Also, the initial goal was to create a Gulf network between Oman Clinical Skills Center in the Gulf region, and we actually were successful in that. So this year we have more participants from the Gulf countries. We have people from Saudi, people from Qatar, people from the Emirates that are actually participating as a speaker and also as organization and part of the organization committee too. So actually we achieved what we wanted from the first year. Now we're actually gaining that result.
Sure. Well, what I would like to discuss is the connection of patient safety and simulation. I see connection on many levels and I would like to explore them a little bit. We often focus on using simulation for training, but I think there's actually more also what we can do with simulation.
Simulation-based education is a technique that is used in theory and practice that is of significant importance to the medical field, enhancing patient care, treatment, safety and communication.
I think we've really built the big difference from last year is one, we have some new plenaries who are really looking at simulation and its role in patient safety and looking at research. But I think the most exciting thing about this conference is the actual delegates themselves bringing their research to the conference. So we had over 30 abstract submissions for this conference, and all the delegates are presenting their work. We've got delegates from the UK, delegates from Europe, as well as delegates from the Gulf. So it's truly becoming an international conference.
I've been invited to give a plenary lecture on simulation training in the emergency clinical setting, and I've also run a workshop today on the same theme of how to go about setting that up. I think the main thing was the concept of although this is a magnificent facility, clinical skills, not every hospital or every department can have access at all times for their training to clinical skills centres, and the ability to do simulations within their clinical setting it increases the role of simulation and also increases the exposure of simulation to the entire team, and it really helps both the nurses and the doctors work together as a functioning, safe and effective team.
This year, the conference mainly focused on patient safety and how to utilize simulation to enhance clinical skills in primary, secondary and tertiary care while exchanging knowledge, technical expertise and resources. In cooperation with the University of Dundee in Scotland, Dasman Diabetes Institute launched the second International Gulf Clinical Skills and Simulation Conference to accommodate practitioners and researchers from the region in enhancing patient safety. From Dasman Diabetes Institute, this is Sarah Glubb reporting for English News.